Today I want to show you how you can create your own digital mockups to perform a gingivectomy guide for your cases, which can be done with a bisacryl, or you can send these files to your dental technician so they can create a gingivectomy guide based off of your own 3D design. Facially guided 3D wax-ups and mock-up trials should always be included as part of the treatment plan process to ensure the success of the treatment, as it combines the practitioner's clinical analysis while checking on the facial proportions and aesthetics. In this multidisciplinary treatment plan, SmileFy 3D's My Design was used to create a 3D wax-ups for different stages of the case. But for the purpose of this webinar, we will go over the gingival guide and studies in this part. So here I have a 40-year-old female patient that came in for aesthetic improvements of her smile. An aesthetic analysis showed the necessity to reshape the teeth form, correct uneven gingival margin, and whiten the teeth by changing old composite restorations and replacing them with crowns and veneers. The patient requested to keep some of her gingival exposure to maintain the identity of her natural smile. Looking up close, you notice that this patient has an uneven smile zenith, and it's slightly canted towards the left side of the picture. I noticed that the canine has a proper height and it's properly positioned, which means that I should use this canine as a base for my entire gingivectomy. So in order to do that, I can use the SmileFy Smile Simulator, which allows me to illustrate the potential final outcome simply by taking a picture of this patient and placing this smile outline. I am going to use the tools here at the bottom to identify the best smile simulation that could look as close as possible to what I'm planning. I noticed that based off of this smile curvature, I need to do a small reshape on the lateral, perform a gingivectomy on those two centrals, so that way they become much longer and look more harmonious to the overall picture. The gingivectomy here on the patient's right lateral needs to be a little bit longer than this lateral here. And on the canine, I need to probably remove a 0.5 millimeter just to keep that same height from that canine. This is a quick way for you to initiate the treatment plan, initiate the 3D design, and then move forward with your peri-analysis as well. Of course, in this simulation, I'm not able to add any measurements, right? Because it's just a picture, it's just a quick way, a quick draft for me to proceed with the digital wax-up. But it gives me and my patient a better understanding on how it could look like towards the end. Noticing the position of my zenith, of my central incisors, the frenulum stays on the way, which means that if I want to create this type of shape, I will also have to do a frenectomy on that area. To initiate your 3D design, the first thing that you have to do is to upload these files, such as the photo, upper and lower, into oral scan, and then merge them together. The benefits of creating a 3D design using SmileFy is that instead of creating a wax-up without having facial references, you design and do your facial analysis all together. Here, the patient's identity is hidden. So I'm not going to show the patient's full face. But just by looking, for example, here at the patient's nose bridge, philtrum, and chin, I can already understand that my patient's facial midline moves towards the right side here of the picture. So as you design, as you deliver your smile zenith, as you create the smile curvature, you gather all these informations and deliver a more natural looking 3D walks-up, which will help not only you, but also the patient to understand that her smile must be unique as her face. Moving forward, we start calibrating what we call a smile frame 3D. So instead of using a smile outline only from a frontal view, just like on the smile simulation, you create a smile frame that covers all teeth in the arch. That way, the teeth proportions and height stay more accurate from every angle. Here, I'm defining the occlusal view, which will define where the 3D teeth will be positioned. And you also define where the smile frame will be positioned from a frontal view and a profile view. The smile frame 3D will predefine the teeth proportions and height. Since we are focusing on a gingivectomy case, we will focus on this red line here on the top, which represents the zenith area of your upper anterior design. Now that I have calibrated the files and pre-selected the proportions of the teeth in the 3D smile frame, SmileFy automatically places a 3D template over my intraoral scan. And notice that the proportions follows the proportions that I chose in the 3D smile frame. My next step was to select a 3D template that would best fit my patient's face. And in SmileFy, there are several 3D teeth for you to choose, where you can select the entire 3D teeth frame, or you can fully customize just like the way I did here. Simply tap on the tooth that you would like to have, and it will automatically appear onto the 3D walks-up. If I want to, let's say, change the height or any proportions or rotate the tooth, I can simply tap on the tooth and then use the commands here at the bottom and, for example, adjust its height, width. In cases where a gingivectomy guide will be used for the case, it's highly recommended to bring it as buccal as possible. In my perio analysis, I used a perio probe, numbed the patient, and did the measurements from the bone crest to the CEJ and from the CEJ to the border of the cervical margin. And I can use those measurements that I did manually and apply into my design to make sure that I have an accurate 3D gingivectomy guide. And with a ruler, you can confirm the measurement that you did on the patient's mouth. So here I can also adjust the height. And so on. From that smile simulation, we were saying that we were going to use this canine as a reference for the guide. So here, as you can see, there is no changes on this canine, a small change on this lateral, some changes on the central, then the lateral will copy the same format and same shape of that lateral. That's why we will remove some gingiva in here, and then here about an average of like a 0.5 millimeter, just to match the same height of this canine. Before exporting the 3D walks-up, you can do final adjustments in the mesh editor of the application, and that helps you define proper teeth contour, over margins, embrasures, papilla, and to determine the thickness of that design. In a gingivectomy case, always make sure that the thickness of your design is pretty thick, especially here on the zenith area, because that will serve as a reference for your gingivectomy. Let's say if you are thinking of doing a gingivectomy using a bisacryl as a guide, or if you're thinking of sending it to your lab so they can create a gingivectomy guide, the highlight of that zenith will help you or the dental technician to better perform the guide for your dental procedure. Notice that here you're able to see final details of the design as well, and the same design later will serve as a guide for your future restorations. The 3D digital walks-up was then exported as an STL file and printed in office using a SprintRay Pro 95 3D printer, which is an excellent 3D printer if you want to have a fast, reliable 3D digital mock-ups in your practice. After I placed the mock-up on my patient's mouth, I wanted to make sure that the contouring looked exactly how I planned and it was pleasing to the patient's likings. I made a very small adjustments onto the laterals, so it would be slightly more rounded as I planned. I used a flowable composite for that, like cured, and then I re-scanned the patient's mouth with the mock-up and sent all these files to my lab so they could create the surgical perio guide for me to perform the procedure on my patient. Creating your own digital mock-ups now is very easy, and it helps your dental technician and your patient to understand the treatment plan that you are proposing. And the best of all is that when you create these digital mock-ups with SmileFy, you also create a facially guided treatment outcome, which means that not only your patient will look amazing, but your work will look much more balanced and harmonious in the final outcome. If you are already a SmileFy member or would like to become a SmileFy member, you also have the chance to come into one of our courses that we run throughout the year. Simply go to smilefy.com and look for SmileFy courses to find the best course that fits your needs. I'm Dr. Diogo Alves, the Clinical Director of SmileFy Academy.